Welcome to the Digital Customer Experience Podcast by Kiosk. I'm thrilled to bring you stories, insights, and expert opinions on the ever-evolving world of digital customer experience. Today, we have an amazing guest, Marlon Parkler. She is the mastermind leading Pfizer Sweden. She's not just steering the ship, she's redefining how we connect with doctors and patients. With a science-powered vision, Marlon's driving Pfizer to be the partner that healthcare future needs. So let's dive in and get the inside scoop on shaping a healthier world with Malin. Welcome, Malin.
Thank you very much, Daniel. Happy to be here.
Oh, we are so excited. And because you're coming from Sweden, and Sweden is known for music, I want to ask you a question. What musical instrument would Malin be?
That's a super interesting question, but it happens to be so that I used to play the violin. And my brother, he plays the cello. He's a cellist. My father used to play the contrabass. So I think a string instrument would be something that I would choose. Love music.
That's amazing because Sweden just won last year, Eurovision as well. And apart from that, there are so many famous singers and musicians from Sweden. Who is your favorite artist from Sweden?
I mean, there's so many. I mean, we're the biggest exporter, or at least we were, of music. But when we're at the topic of digital and digitalization, etc., so I would say ABBA, because they changed the customer experience totally now with the new Voyager journey with their avatars.
Absolutely. Talking about very famous people, is there someone in the past or in the future you want to meet or you have met that has inspired you?
So I met a lot of people. I meet a lot of people. I'm very curious in people and different perspectives. So I think everyone is interesting. It is the mindset that you have to have, I think, because you discover new things then and learn. But I have two people that I think, I really got a lot of inspiration from meeting. And they're both global CEOs. And they're both actually Indian-born Americans. Very interesting, I think. It must be something about innovation there or mindset or something. But the first one was the CEO of MasterCard. He's not the CEO there anymore, Ayabanga. He's now at the World Bank. And the second was Satya Nadella at Microsoft. Wow.
Well, how did you meet them? Did you have any conversations with them? Can you share a little bit more about the encounter?
Yeah, so I have been engaged in the American Chamber in Sweden for quite a while in the board. So through that, I met leaders when they come to Sweden. So that's a very nice benefit of being engaged. I think the most interesting conversation was around how do you inspire your people and colleagues to, unleash their biggest potential. And also, I mean, the how you bring the soft leadership to make great business and good stuff for your customers, as well as how do you follow where the world is going and how important that is. And especially what I loved the most about these two gentlemen was that they were so curious and they were so interested in listening to what you have to say, to what everyone had to say. So that's very inspirational for me.
Love it, because all of the good leaders are very good listeners and they constantly want to learn how to become better leaders. What is this one thing that you took from both of those persons that you applied in your work or with your company?
Always be curious and open-minded.
I heard once, because I once heard this amazing saying by one of my mentors. He said, be open enough to having your opinions changed. So yes, you could actually do that by being curious. Cool. Yes. One last thing about your personal stuff that I want to know. Finland and Sweden are always competing when it comes to winter games and ice hockey and so on. Are there sports that you love or that you're interested in?
So I like testing all kinds of sports, but I love the outdoors. So everything that is outdoors, if it's mountain biking, skiing, cross country or downhill, sailing, um, and hiking, running, whatever. As long as it's outdoors, I love it.
Amazing, amazing. Now let's get into the nitty gritty of the pharmaceutical industry. So, as you said, you're always thinking about new way of working, new way of improving. And how is this evolved to meet the customer's digital needs?
Yeah, so first of all, just, I mean, for us as a company, digitalization has totally revolutionized the way that we discover drugs, for example. I mean, that is our core. So it's constantly improving also the journey of making a medicine and a vaccine, as well as it's been reinventing the patient journey and healthcare. But as you're referring to as well, it's not only revolutionized there; it's also revolutionized the way that we meet our customers' needs and the customer experience, or the experience customers expect. And for us, customers, healthcare professionals, physicians, nurses, of course, and then patients, but also government and governmental agencies. Due to this, we're all changing the way that we engage our stakeholders or engage with our stakeholders. That reflects the increasingly always on world, and the expectations to have science and knowledge at the fingertips of healthcare patients. So I think this is the big challenge, and also the big opportunity to make available whatever you have at the fingertips whenever you need it, a click away.
Yep. And just piggybacking on the first question, we're talking about new ways of working and evolving. With the pandemic, so many things had to change. Not just with certain industry, with most of the industries. How does this disruption change the approach of the Pfizer to meet the customer's needs?
I mean, we can in this change, we can unite the power of science and the power of technology, I think, and also the way that we're agile. So the way that we've been, developing the ways of working, you can kind of say that we've done it in a number of ways. There are some buzzwords maybe to talk about here. It's agile methodology, user experience, patient journey, as well as omnichannel. All these, buzzwords, they have a fundamental meaning in the way that we work. So agile methodology is the way to constantly make sure that you have content available. So in a very fast way, you can make sure that you have updated, relevant content for different type of customers based on both what their role is or who they are as a person. So this is fundamental in the way that we're working today. And also when we talk, and maybe we come back to that when it comes to omnichannel. But I think it's not only the way that we work, externally engaged. It's also the way, as with the agile methodology, the way that we work internally. So you always need to find a way to simplify, to keep the speed, because expectations are so big now in what, when you're looking for something, you want the answer immediately. You want the solution immediately. That's the way that our customers experience their personal life. So they experience that in their professional lives as well. So I think this is the challenge, and also a fun opportunity to make sure that you actually, put together everything that you have and make it available in a very attractive way for the customers. But it has to be simplified, and that's also a challenge. I mean, in our business, or the way with our in the pharma industry, we are a very restricted, a very regulated environment. Many different businesses are very regulated, but for us, it's in the engagement with healthcare and patients. I mean, we can't engage with patients when it comes to specific medicines. We can't. There's certain things that we can say and cannot say when it comes to healthcare. So there's so many things that we need to be compliant to do. So it's not so easy to be quick, and we can't give too broad information either. So you need to stick with what's compliant, and then you can just guess how many processes that is internally then to make sure that you are compliant. So I can give one fun example when it comes to digital disruptions. And the first big leap that we did, and also why I think that's also a good example for when you digitally disrupt is when you need to find another solution. So before 2010, somewhere 28 maybe, the industry changed so that we couldn't travel to congresses together with our customers. We could travel to congresses. We couldn't bring a group of customers there, which makes sense today, I think. But that was very disruptive for everyone, because how would you then, get to learn what's said at the Congress? So there was lots of frustration around this, but we decided to do overnight reporting from the Congress. So we bought film cameras, and my own colleagues, that are customer-facing colleagues, they did all the work. So they interviewed people at the place, sent the videos to one colleague who was sitting, waiting in the evening. He pulled everything together. But then you can't just send it, because you need to have an approval to make sure that the content is not going outside of what you can talk about and not. So they did the overnight. We had people standing by doing the overnight approval. And then the next morning, all physicians or healthcare professionals at home in Sweden could see what was going on with comments from their peers at the Congress. So I think we still do these things. Many companies do now. But that was such a fun journey, because it triggered us to do something differently. It got everyone involved, and you could really show that what you can do if you're all in there together. Then you can't work 24/7 as you do when you kind of find a new solution and you're kind of disrupting. But it's very inspiring, and you get everyone joining the journey immediately. So then everyone was interested in doing these things. So I think that's the difference between when you can disrupt and when you do slow innovation, because my own experiences as well, and my frustration is that sometimes it takes so long to change. Sometimes it takes so long to adopt a new technology or something. And personally, I'm maybe the one that jumps on too quickly to new solutions. And but I think this is, that is what is needed. You need some big external challenge, a change like this, or as you see with the pandemic. That's also a great example when you're forced into trying these technologies and you just realize that, wow, look at what I can do. Yeah.
Thank you for sharing this story. Like, when you're sharing this story, I'm actually thinking of the Oscars. When Oscars is happening, there's like a huge team behind waiting for camera 7, camera 6 change. And I see Malin as a director who's running all of this. With power comes responsibility. And with you saying, I'm the one that's ready to jump in, try new stuffs. Did you think actually hey, this is something that we need to change in the long run, not just now? Were your thoughts like that because you actually made this happen?
That is a really good question. No, I don't think that I thought that would be, a long-term change. That would be. I think we always need to change. So I'm kind of thinking, okay, this is what we do now. What do we do tomorrow? so, so I think,
Makes sense. You can be better every day.
yeah.
That's true.
So,
That's true.
and I think that I'm maybe not the director. I'm kind of the one that I nudge. I'm maybe the little ghost that, supports and try to make people go in certain directions because people have so much to give. So I just try to
And
unleash.
because everyone is super different, like Marlon is this really dynamic personality who can, be in the outdoor sports, who loves music, who loves, inspiring people. But not everyone is the
Yeah.
same. How do you make sure the transformation that you have in the company is being met and followed by everyone throughout the company? It's a hard decision to make and a hard process to execute. How do you make it happen?
So that's when you need people exactly like you're pointing at. You need people that are different from you. So I know that I need people that take some time, deep dive into something, see, okay, how do we do this and how do we develop it? So my colleague Paolo that has been developing the way that we work with, if you call it digital marketing or digital customer engagements. He's the one that's been very solid in setting plans. He's been taking all the ideas into, how do we now structure this? And that's why he also brought in the agile methodology to structure everything so they can do things with speed as well. So you also unlock some time for innovation because you need to, all the things you can do, you need to do those things, but then you also need to have the time to innovate and change. And one of the big thing that he developed was also taking because after all this Congress reporting, we also understood that moving media is something that we want to be good at. So sometimes you just have to pick something, and then Netflix. The Netflix model is of course a guiding or a North Star for everyone, I think. And then so he developed a platform called Pfizer Play, which is more or less like a Netflix platform, where physicians, it's for healthcare, of course, not for patients and not for the public.
Can you expand a little bit on this? Because this is very interesting.
Yeah, so that's where we gather all the videos we have. So if it's interviews, if it's webinars, if it's some education, and depending on who you are, you can easily, as with Netflix, get suggestions on what can you learn now? What be based on what you've been watching and been interested in? What would be beneficial for you to look at?
And who is this for? Is it for the HCPs or
Yes.
for internal?
It's for HCPs.
HCPs.
Yes.
Okay, makes sense. So just coming back to the analogy that we were making, like a director and Oscars, and I also see that you're building a team that is so different but has their own strengths. Which brings me back or moves forward to the next question of an omni-channel approach. So each platforms have their strengths, and when you bring them together, it is more powerful. What is Pfizer's take on omni-channel approach, especially in the constantly evolving pharmaceutical industry?
Yeah, so I think everyone may have different definitions of omni-channel, and so let me start from where first it was single messages in single channels, or the same message rather in single channels, and then once we started with a multi-channel, everyone did multi-channel, and you pushed out one message or one knowledge in many channels at the same time, and you work with campaigns. Now with omnichannel, it's based on the customer need. So what does this exact physician need? And how do you bring that person on a journey that give them something, that make them better in their daily life? So that's, what most people want. How do I get better in what I do? So how do I get to be a better leader? Or for a physician, how do I be a better doctor tomorrow? So how can they learn? You bring them on a learning journey. instead of sending a message. So you use all the channels you have and use them for different purposes, for different learning journeys, but also to attract different type of learners, or the way you consume digital knowledge or find solutions. So it's all about using the channels. I mean, you have to choose an area for learning, of course. You can't do everything. You can't put everything into a bucket of omni-channels. You kind of travel around there forever. But the purpose is to really make sure that you give full content and continuous learning. So, I mean, you talk about learning
So
organizations, but
are you meaning to say that the omni-channel approach with regards to Pfizer is mostly for educating?
I would say so, because in our, our what the healthcare professionals expect from us is
Yeah.
science, evidence, and also practical. So it's kind of two parts: practical knowledge and learning, and medical learning and knowledge. And that is what we supply. We want them to we want to ensure that they have everything they need to choose a medicine and vaccine when it's proper for the patient, and also make sure that the patient gets the best results from their treatment. So that's our mission, to ensure that patient gets access to a healthier life. So we need to supply or support with the knowledge, the science behind that. So yes, I guess it's about education.
And I'm assuming that because now you have omni-channel approach to educate your HCPs, do you have a data on which form of content performs well? Meaning that, hey, this is A is performing well, so we're going to optimize and enhance more of A. Do you have a data or platform that the HCPs prefer?
So what we see is they prefer live or recorded webinars, short videos, especially peer-to-peer. They want to learn from another physician, or if it's a new medicine, of course, they want to know the practicalities. But otherwise, they want to learn science, not only theory, but also practically from a peer. So that is super important for them. At least what we see in what is mostly looked at when it comes to what we bring digitally. But then it's also very interesting what we say, how do we know? So measuring is, of course, crucial. Making sure that you measure what the customer, if we're satisfying the customer, if they can, if they recommend. So we need to know whether or not what we're providing is, what they want. So that type of tracking is super important. And we regularly work with insights. So the team, we mix, of course, omnichannel is not only digital, it's also for us, it's also the face-to-face meetings and other type of events that we organize, which put everything together. So the insight we gather is super important, whether or not it's by measuring digitally, because it's so easy. When you're online, you can measure more or less every tweak and stuff that customers or people do, but then also insights from customer-facing colleagues that are out meeting healthcare. So that is also what's within the agile methodology. The one really big piece is to feed in insights all the time, so you can tweak. There was one other thing that I was thinking about when it comes to insights and measuring. Yes, so my passion is also to measure, not only click here and then the person went there, and then my passion is to measure that it really makes a difference for the physicians or the nurses or the healthcare professionals. So we track NPS, Net Promoter Score is well known, and CSAT, customer satisfaction, is also well known. What we've added that I personally love is did this have an impact on your clinical practice. So did this really help you in being better as a doctor or a nurse? So I think that is, if we can have a high score on that, then I'm super happy.
Absolutely.
Then we've done our job.
Absolutely. Thank you, Marlon. And now the next part is really a most commonly discussed topic these days. So AI is something that every company, every field is embracing. So for Pfizer, where do you see the biggest opportunity with regards to digital transformation to leverage the potential of AI?
So I think, everyone knows that the next years, the biggest technology that will change the way we operate, the way we do things in all dimensions, all perspectives is AI in all different ways. So, and it will have a super great impact on what we do. It also has some, everyone talks about the negative things, and that is actually very crucial that you do and use AI in a secure and safe way. That is, it has to do both with the value you bring, but also with your reputation. And I think here is also very, companies have to also lead the way when it comes to how you use AI. And also be very transparent, of course. But there are many compelling uses for especially then, I think in this context, maybe we talk about generative AI, Gen AI, videos, text, etc., how you can improve that. So for some examples from our industry, that's not only like content per se, is a very interesting thing is how you accelerate the way that you predict how protein folds. And that can actually answer questions on biology and how you can find a new medicine. So that is, of course, core. Then you can also reduce cycle time, time to patient from discovery to that patient gets treatment, they get a healthier life by reducing certain parts of clinical studies. You can have an AI looking into big data to see are there any false data in this, or anything that needs to be washed. How do you wash it? So that's one thing. But then when it comes to maybe what we're talking about here, when engaging with healthcare and patients, it's you can better and faster come out with qualitative content to healthcare providers. And as many companies, we've launched our own secure, safe area of our internal chat GPT, an internal Gen AI platform, and exploring on that. I think we're not alone in that. I think everyone is doing it and exploring to see how can we use this and how can we learn. I've tested. I needed to do an elevated speech about myself, so I tested to throw in data. It was super fun. I sounded like such an amazing person. And they give nice fancy words and then put it together. And then I also used it for preparing for a panel to discuss learnings from preparedness for crisis. So it's amazing. You get a really good draft. But in near term for us, it will be translating global materials. We're a global company. We don't do content. We do content locally, but we also do lots of content from a global perspective to be more efficient, of course. We can also, in that, you can use AI to create different tonalities. So, and also, summarizing reports, etc. And also test different type of languages that fits different personalities or customer groups. And of course, efficiency and productivity. So there's so many interesting and good ways to use this. Then you also have one thing that is something that we need to all handle is also um, the uh, uh, the challenges with that you can really how do you say it fake things. So I mean, you've seen the panda driving the car, for example. Yeah, it looks super real. And so that's a little bit scary, but I guess you will find ways to identify.
It comes down to ethics in AI as well.
Yes.
One use case that I was thinking, like when you were speaking, is like, because you said peer to peer videos are very popular. My immediate thought was like, what if, let's say, I'm a very popular physician, but I could translate and speak in 20 different languages. I'm the most respected physician with regards to, X, Y, and Z. But if I could do a video, but then using a software like HeyGen, it just translated to 20 languages, speak 20 languages, and reach people from 20 different countries. That would be amazing. I'm like, oh, this is something possible with AI. So have you ever thought about something like, because peer-to-peer is one of the most trusted methodology with regards to Pfizer. Have you thought about that idea?
That's a super interesting idea. Unfortunately for me, I'm like, oh no, how do we solve this so it's compliant? We make this,
That's true. That's true.
But I think, that's, you can always try to explore things first internally. So I'm thinking, if I would be a global leader, wonderful. And I think that would be so fun if that would be available. A couple of years ago, I worked on a global project for a year on transforming the way we engage with customers across the whole world. And that would have been so fun if I could have, done things in the local languages. So I think we can try these things. It's a very interesting idea. And not only translating. I mean, and now I understand also, when it comes to, or not understand, but the discussions from Hollywood and movie stars, it would be very easy to change the language. Maybe just keep the tonality, because otherwise when you dub the movies, it's not the same. But I guess now with an AI, maybe it can be felt the same if whoever big star is talking in.
Absolutely. And now, because we're coming towards the end of the podcast, and what I'm realizing is I'm talking to a leader that believes in transformation, that believes in embracing the change, that believes in motivating the people that he or she works with and works under. And the most important thing that I want to know, what is your leadership style? And do you have any advice for young leaders or leaders in general who's not ready to embrace change or transformation or AI? What is your advice for them?
So first, type of leader I am. I'm a leader and not the boss. So I'm more visionary, showing direction, inspiring, and very inclusive. And so I don't like consensus, but I like inclusiveness. So I want everyone to be able to speak up and to feel comfortable. So I value creating psychological safety because otherwise you won't have people speaking up. You will not get different perspectives, etc. I want people to bring everything because then you find better solutions. I get people to I don't only network myself. I pull people together, and I want my people to network with others because that's when things happen. So for me, we're in it together. It's maybe, the most important value for me to make sure that you bring everyone's potential out. We've been the last number of years, we've been exploring this concept of self-managing organizations. The furthest you can come is called the teal organization. And that is when you don't have you don't have any bosses or you don't have titles. But that's very hard in a global American company to get there. But it's all about inspiring teams to really drive themselves. So if you find something that you can improve, you just do it. You just bring on the people that you find in the organization that will be best suitable to be on the journey with you, and you do it. So that is for me, if I feel successful when I notice that stuff is going on, wonderful stuff is going on that I didn't know about, and that just pops up in the organization as brilliant solutions. Or so that is important for me. When it comes to advice, be curious on technology, be curious about communication, be curious about people, test new things, go in the forefront, just, do it yourself a bit as well, so you understand what it's all about. Network. When it's curious about people, network, talk to people, just try to understand them, try to say, okay, what do you bring? What can I learn from you? Invest. So invest in technology, invest in competence, and it takes time. Most of the time it takes time. And so be persistent, and it will happen, but it will take some time. So keep believing, be persistent, and keep investing. Because if you're not persistent and keep investing, then you will never achieve what you could achieve, because you quit too early. And then also we talked about this internally, the difference between creating a business strategy for a digital world instead of creating a digital strategy for your business. So you create your business strategy adapted to a digital world, not the other way around. I think that is a good concept to have as well. And make sure that you create a culture around you that thrives and invites curiosity and innovation. That would be some of my advices.
Thank you so much. I love when you talked about emotional safety. And that is a very, very important quality of a very, very inspiring leader. Thank you for addressing that. And as you said, the best investment one can make is investing in themselves. Then to learn skills and constantly grow. And that shows what an amazing leader you are. And it was a pleasure to have you in our podcast. So all I can say is, I've met a superstar from Sweden who is also happened to be the CEO of Pfizer. So thank you for joining us in this podcast. It is amazing to have you, Mark.
Thanks, Daniel. It was an inspiring chat. You got me to think about lots of different things. So thank you very much for that. Good start of the day.
Thank you. And for our audience, if you enjoyed this episode, don't forget to like, share, and subscribe. For more in-depth discussions on the digital customer experience, drop us a comment below with your thoughts or any question that you might have for Malin or future guests. Until next time, stay curious and keep innovating. This is Daniel Call from Gears.